Okay, hello, I'm Michele Mouttapa, Dr. Michele Mouttapa from the Health Professions Advising Office here at Cal State Fullerton. I just want to congratulate you on being accepted for the HCOP program. And since I can't be with you today in person, we agreed to do a video so that you get to know a little bit about me and our office and what we can do for you while you're still here at Cal State Fullerton.
Thank you, Dr. Mouttapa. Can you share personal and educational backgrounds and a few of the challenges you may have?
Okay, so yeah, I'm one of these kind of people who just followed my nose as I went. I don't think I ever knew definitively what I was going to do right from the beginning, but I started at UC Davis as an undergraduate student. I had some notion that maybe I wanted to be an MD, a medical doctor. Took some of the science classes, got as far as organic chemistry, and I realized, you know what, this isn't for me. But a class that I really did enjoy was psychology, the intro to psychology class. So I became a psych major and I loved it. I graduated with that and did just well enough and did well in the GRE to get into a master's program in psychology here at Cal State Fullerton. And what I discovered there, I had intentions at that point to be a clinician of some sort. But what I realized what I was stronger at was statistics. I enjoyed that. I got A's in that. And that really encouraged me because I was successful in that. And from there, what I did is I applied for a PhD program in health behavior research at USC because that's kind of research focused and publication focused and statistics focused. So I got into that and did a postdoctoral fellowship program at Johns Hopkins and then at UCLA. And then I got the faculty physician at Cal State Fullerton. At Fullerton, I was in the Department of Health Science, now known as Public Health, and I taught statistics and research methods for 9 years. And in the last 3 years, I've been at the Health Professions Advising Office, where I help students get into health profession schools, which include medical school, dental school, pharmacy school, optometry school, and some others. And those are all considered traditional health professions. So you're going to get these bookmarks, and so you would have had one by now. And those are the health professions we advise for. But on top of that, we've recently, in the last year, advised for allied health professions as well, which include physical therapy, occupational therapy, social work, counseling, speech-language pathology, those kinds of things as well. So yeah, we've expanded our advising as we've gone along, and those are the things we advise for.
Wow, thank you for sharing your personal and educational background and what the Health Professions Office can serve for the students. Are there any other resources that the students could receive from visiting the Health Professions Office?
Yeah, so just in case you didn't know where I was, I'm in University Hall, room 223, which is in between what is now Carl's Jr., but I think is becoming Chick-fil-A, and Aloha Java. Yeah, I think it is becoming Chick-fil-A.
Oh,
that's what I've heard, but I don't know if it's true. And so we're in that building, second floor. And in terms of the resources I provide, I would say students early on typically come to my office for 20-minute appointments, just for a lot of things. I think the most common reason I see students, especially when it comes close to registering for classes, people want to know what classes should I take. Does this schedule look good to you based on what I want to do and what my major is? So we go over those kind of things. And a lot of times I just talk to students, okay, so how come you want to be a doctor? Or do you want to be a nurse? And have you done these experiences, for example? Have you engaged in community service to get you best prepared to get into the health professions? We talk about those kind of things. You know, sometimes we even talk about family life, like, okay, how does this fit in your family life? Is these your parents' expectations, or is this what you want to do? So sometimes we even talk about those things too, let alone the basic logistics. So those are the services we provide in terms of advising. I do have resources in terms of, I have sheets where we write down, these are the classes you should take if you're going to be pre-med or pre-dental, pre-pharmacy, all those things. So we have those kind of resources. We also do have a listserv, so if you decide to join that, if there's any major announcements. So a lot of times, if an opportunity comes up because somebody sends me an email like, oh, USC is hosting a event where we want pre-med students to come, I will post it on our listserv so that students can be aware of it and can attend if they want to. I also advise students to join student organizations that we have, so I tell them about that. For example, we have pre-med student organizations, we have a pre-dental society. We have the Student Health Professions Association. So that a lot of times I steer students in that direction to meet other students who have the same interests they do, meet guest speakers who are in the profession they're interested in being in so they could learn more, so they just feel more connected and more of a community. So those are some of the major things. Another thing that we do is something called intent to apply. So when people are just about ready to apply to, let's say, medical school, they can get a committee letter of recommendation from our office. So if they meet certain qualifications in terms of GPA and experience, and they turn in an application, we use that information to write a letter of recommendation on behalf of our Health Professions Committee, which consists of faculty who look at your application and say, oh, this is a good candidate. And so we basically write letters of recommendation for qualified students.
Oh, okay.
Yeah.
That's really good to know.
Yeah. And I also help people with their personal statement. I've been the editor, I had been in the past an editor of a journal for, gosh, how many years? 6 years or something like that. So, I have a knack for helping people edit their personal statements to get, to make that as shiny and as bright as possible. People come in for interview experience too. So if they turn in their application and then it ends up resulting in them getting interviews, they come in oftentimes and practice their interview skills. And I tell them what they can work on, verbal, nonverbal, that kind of stuff as well.
Okay.
Sorry to cut you off, but yeah.
No, it's okay. And then for the students to have access to these resources and meet with you, what would be the best way?
Oh, to access and meet with me. So you have your bookmark here. And so at the very bottom and the front side, this is the back side where it talks about the student organizations. On the front side, we have fullerton.edu Health Professions. This is my link where where people can set up their 20-minute appointments. So they have little slots for, oh, this slot's open, that kind of thing, and you could book it. So that's one way to do it, and you could see when I'm available. We are open 12 months out of the year, so we're not closed during the summer. We're not closed during intersession. We're only closed when campus is closed. And, aside from me taking some vacation here and there, we're pretty much open throughout the year. So I generally have appointments from 8:20 till 4:30, that kind of thing most days.
Oh, wow.
Most days. And so you could book an appointment like that. Some people, oh, and another thing is if you live far away, if it's just not a convenient time for you to come to my office, we can do phone calls as well. I often do phone calls with students. If it's not as convenient for them to come to my office. Sometimes people would rather email. They'll email me questions and I just email them back within a day or so, a day or two typically. So they can access me that way. Another thing that students should know is even if you graduate, when you graduate, if you're getting ready to apply, let's say to dental school, you could still come to my office. So I see alumni all the time, such as yourself. You might see me, for post-baccalaureate programs, and that's fine. That's absolutely fine. So yeah.
Thank you. Thank you for sharing this information for us. And I'm sure the students will be meeting with you soon throughout the semester to make sure they're on track for their career.
Okay, thank you. And if I had to give you any word of advice, is to keep your grades up and have really good time management, because I feel like a lot of students starting when they get to undergraduate, they just don't know what it takes. It's not for a lack of intelligence, it's just a lack of, oh yeah, I need to study the time management. For me, especially, I would say high school came pretty easy to me. When I got to college, there's just so much more material that you need to learn. So just pacing yourself and having very good time management skills and discipline, I would say would be the most important thing for you. And then secondly, to get the experiences in the field that you're interested in, which I'm sure you're going to get through the HCOP program. All right.
Okay.
Thank you so much.